Hey there, cat lovers. Before we dive into today's mind-blowing topic, make sure you hit that subscribe button and ring that notification bell, because what I'm about to reveal will completely change how you think about your feline friends. Trust me, you don't want to miss this. So picture this. You're at the vet's office, and the doctor just told you your beloved cat needs to have their teeth removed. Your heart sinks. Panic sets in. You're thinking, how will my cat eat? How will they survive? Will their quality of life be destroyed forever? I get it. I've been there. And I'm here to tell you something that might sound crazy at first. Your cat will be absolutely fine. In fact, they might even be better off than before. Sounds impossible, right? Stick with me, because by the end of this video, you'll understand exactly why losing teeth isn't the disaster you think it is. Let me start by blowing your mind with something most cat owners don't realize. The myth that's been lying to you all along. Here's the thing. We humans have this terrible habit of projecting our own biology onto our pets. We chew our food thoroughly, grinding it down with our molars before swallowing. So naturally, we assume cats do the same thing, right? Wrong, dead wrong. The truth is going to shock you. Cats don't actually chew their food the way we do. Let me say that again. Your cat has never truly chewed their food in their entire life, not once. You see, cat jaws can only move in one direction. Up and down, that's it. They can't grind side to side like herbivores or omnivores. Their entire jaw structure is designed for one purpose and one purpose only: to kill prey and tear it into chunks small enough to swallow. Think about it. Have you ever really watched your cat eat? Really watch them? They grab, they bite, they swallow. Boom. Done. There's no chewing happening there. Those sharp, pointed teeth? They're weapons, not food processors. They're designed to puncture, grip, and rip. The canines, those long fangs, are for delivering the killing bite to prey. The tiny incisors at the front are for scraping meat off bones. And those blade-like premolars and molars? They're specialized for shearing through flesh and crushing small bones, not for grinding and chewing like our teeth. This is the secret that changes everything. When you understand that cats are designed to swallow their food in chunks, you suddenly realize that teeth are just one tool in their eating arsenal. And not even the most important one. Nature's backup plan. Your cat's hidden superpowers. Now here's where it gets really fascinating. When a cat loses their teeth, something incredible happens. Their body doesn't just give up, it adapts, it compensates, it finds another way. Let me introduce you to your cat's secret weapons that have been hiding in plain sight all along. First up, that adorable pink tongue. You know how it feels like sandpaper when your cat licks you? Those aren't just cute little bumps. Those are called papillae, tiny hook-shaped structures made of keratin. The same stuff that makes up their claws. These papillae are absolutely remarkable. They're angled backward toward the throat, creating this perfect conveyor belt system that moves food exactly where it needs to go. When a cat has teeth, these papillae help strip meat from bones. But when the teeth are gone, these little hooks become even more important. They grip the food, manipulate it, and push it toward the back of the mouth. It's like having hundreds of tiny fingers on their tongue. But wait, there's more. Those gums you probably never think about? They're tougher than you imagined. Much tougher. While they can't bite through raw meat like teeth can, healthy gums are perfectly capable of mashing up soft food. Think of them like your cat's personal food processor. Not as effective as teeth for hard stuff, but surprisingly efficient for anything with a soft texture. And here's something that blew my mind when I learned it. A cat's entire digestive system is designed to handle large chunks of food. Their stomach acid is incredibly strong, far more powerful than ours. It can break down pieces of food that would give us serious problems. Their intestines are short and efficient, designed for processing mostly protein without a lot of pre-digestion needed in the mouth. So when you add it all together, the sandpaper tongue, the tough gums, the powerful digestive system, you start to realize that teeth are just one part of a much bigger picture. Take them away, and yes, there's an adjustment period, but the cat's entire system is already designed to work around it. Pretty amazing, right? But I know what you're thinking. Okay, so they can survive without teeth, but what should I actually feed them? Don't worry, I'm about to break that down for you in a way that nobody else will. The ultimate feeding guide. What works and what doesn't. Alright, this is the part where most videos would just tell you, feed them wet food and call it a day. But I'm going to go way deeper than that, because the devil is in the details, and getting this right makes all the difference between a cat that merely survives and one that absolutely thrives. Let's talk wet food first, because yes, it is the gold standard for toothless cats, but not all wet food is created equal. Pâtés and mousses are your best friends here. These smooth, homogeneous textures are like the fast food of the cat world. No work required, just pure eating pleasure. When your cat is first adjusting to life without teeth, these are going to be your go-to option. They slide down easily, they don't irritate sensitive gums, and the strong aroma really stimulates appetite, which is crucial if your cat has been reluctant to eat due to dental pain. But here's something most people don't consider: the boredom factor. Imagine eating nothing but mashed potatoes for every meal, forever. Yeah, your cat might feel the same way. That's why chunks in gravy or jelly can be a game changer. But with one critical caveat. The chunks need to be soft enough that they essentially fall apart with minimal pressure. You're looking for that texture where if you press it with your finger, it smooshes easily. If it resists, it's too firm for a toothless cat. Now, let's tackle the controversial question that everyone argues about online. Can cats without teeth eat dry food? The internet is full of absolute statements. Never feed dry food to a toothless cat, or my cat eats dry kibble just fine without any teeth. The truth, as usual, is more nuanced. Yes, some cats will absolutely swallow dry kibble whole. I've seen it with my own eyes, and it works fine for them. But, and this is a big but, it's not the right choice for every cat. You need to consider several factors. First, the size of the kibble matters enormously. Those huge, chunky pieces designed for dental health? Forget about it. You want the smallest kibble possible. And I mean tiny, like the size of a pea or smaller. These are much easier to swallow whole without causing choking or discomfort. Second, your cat's individual health matters. Does your cat have a sensitive stomach? Do they vomit easily? Any history of megaesophagus or swallowing difficulties? Any inflammation in their gums? If the answer to any of these is yes, dry kibble, even small kibble, is probably not the best choice. But if your cat is otherwise healthy, has no digestive issues, and is determined to eat dry food, there are ways to make it work safely. The soaking method is clutch. Take the kibble and pour warm water or low-sodium chicken broth over it. Let it sit for 10 to 15 minutes until it forms a soft, porridge-like consistency. This makes it incredibly easy to swallow and actually improves digestibility. Plus, it adds extra hydration, which is always a bonus for cats. Or try the blending method. Throw that dry food in a blender or food processor and grind it into a fine powder or small crumbs. You can then mix this with wet food to add some variety in texture and flavor. Just remember, and this is critical, use it immediately. Once you've ground up kibble, it starts oxidizing and losing nutritional value fast. Don't make a big batch and store it. Fresh is best. Another option? Look for specialized formulas. Some premium cat food brands make kibble specifically designed for cats with dental issues. These have extra small, easily swallowed pieces that are formulated to be safer for cats who can't chew. Now, here's the part that nobody talks about but absolutely matters: calorie density. Wet food is significantly less calorie dense than dry food. A can of wet food might have half the calories of the same weight in kibble. This means if you're switching from dry to wet food, you might need to feed more volume to maintain your cat's weight. Keep a close eye on your cat's body condition. Are they losing weight? Bump up the portion sizes. Are they getting chunky? Scale it back. And please, please, please work with your vet on this. Every cat is different. Age, activity level, underlying health conditions, individual preferences. All of these factor into creating the perfect diet. Your vet can help you calculate exactly how much to feed and can recommend specific brands or formulations that match your cat's needs. But beyond just what to feed, there are some crucial feeding techniques that most people completely overlook. The feeding techniques that make all the difference. Okay, so you've got the right food, but how you serve it matters just as much as what you're serving. Let me share some insider techniques that can transform your cat's eating experience. Temperature is everything. Room temperature is your target. Not straight from the fridge, that's way too cold and can be uncomfortable for cats with sensitive or healing gums. It can also suppress appetite because cold food doesn't smell as strong. But don't microwave it to piping hot either. That's a recipe for burned mouths and permanently traumatized cats who will never trust food again. Here's a pro tip. Take the food out of the fridge about 30 minutes before feeding time. Let it naturally come to room temperature. Or if you're in a hurry, put the sealed pouch or can in a bowl of warm water for a few minutes. This gentle warming enhances the aroma, making it more appetizing, while ensuring it's not too hot. Texture matters more than you think. You want smooth and pliable but not liquid. Too runny, and you risk aspiration. That's when food goes down the wrong pipe into the lungs, which can cause serious pneumonia. This is especially a concern in the immediate post-surgery period when your cat might still be a little groggy or uncoordinated. On the flip side, watch out for hard particles or sharp crumbs. Even in supposedly soft food, you might find the occasional crunchy bit that could irritate healing gums. Check the food before serving, and if you find anything questionable, mash it with a fork or remove it. Portion control is also key, but not in the way you might think. Instead of 2 big meals a day, consider offering smaller, more frequent meals. Why? Because toothless cats might eat a bit slower, especially at first. Offering food more often means they're never desperately hungry and trying to eat too fast, which can lead to vomiting or discomfort. Plus, it keeps their energy levels more stable throughout the day. The recovery period. What to expect and when. If your cat is having teeth surgically removed, understanding the recovery timeline is crucial. The first 7 to 10 days are the most critical. During this immediate post-op period, your cat's mouth is essentially a construction zone. You've got fresh surgical sites, inflammation, potential bleeding, and definitely discomfort, even with pain medication. This is not the time to experiment with textures or push boundaries. Stick to the softest possible options, smooth pâtés, mousses, or kibble-soaked, to the point where it's basically cat food soup. No chunks, no texture, just smooth, easy-to-swallow nutrition. Your vet might even recommend a special recovery diet designed for post-surgical patients. You might notice your cat is hesitant to eat at first. This is completely normal. They're dealing with pain, the weird feeling of missing teeth, probably some lingering effects from anesthesia, and potentially some nausea from pain medications. Don't panic if they skip a meal or two, but do monitor closely. If they go more than 24 hours without eating, call your vet immediately. Cats can develop serious liver problems if they don't eat for too long. As the days progress, you'll notice gradual improvement. The swelling goes down, the pain decreases. Your cat starts showing more interest in food. Around day 7 to 10, your vet will probably want to do a recheck exam to make sure everything is healing properly. Once you get the all clear, and only once you get the all clear, you can start introducing slightly more textured foods. Maybe graduate from pâté to soft chunks and gravy. See how they handle it. If they eat enthusiastically without any signs of discomfort, great. If they seem hesitant or you notice any bleeding or irritation, back off and stick with the softer stuff a bit longer. Here's what's really interesting. Many cats, even after they're fully healed, choose to stay on soft food, and that's absolutely fine. If your cat is happy, healthy, maintaining a good weight, and showing no signs of digestive issues, there's zero reason to push them toward harder textures. Let them be the guide. The transformation you need to know about. Now here's the part that's going to make you feel so much better about everything. The part that proves this isn't a tragedy, but actually a huge win for your cat. Dental disease is excruciatingly painful. I'm talking constant, throbbing, stabbing pain every time your cat tries to eat. Imagine having a severe toothache that never goes away. That's what many cats with dental disease are living with. And because cats are masters at hiding pain, you might never even know. When those diseased, damaged teeth are removed, It's like someone just took away a source of torture that's been plaguing your cat for months or even years. The transformation can be absolutely dramatic. I've heard countless stories from cat owners who say things like, "I thought my cat was just getting old and lazy. Turns out they were in constant pain. After the dental surgery, they're like a kitten again." Cats who were lethargic suddenly start playing again. Cats who picked at their food start eating with genuine enthusiasm. Cats who were cranky and withdrawn become affectionate and social again. It's like watching your cat get a second chance at life. One owner told me their cat lost 7 teeth due to severe stomatitis. They were terrified their cat would never be the same. 6 weeks after surgery, their cat was eating more than ever before, had gained healthy weight, and was zooming around the house like they hadn't done in years. The vet later told them the cat had probably been in significant pain for at least 2 years. 2 years of unnecessary suffering, ended by one surgery. That's not a loss, that's liberation. So if you're facing this situation with your own cat, I want you to reframe how you're thinking about it. This isn't about your cat losing something vital. This is about removing the source of their pain and giving them a chance to really live again. The bottom line, your cat will be more than okay. Let me bring this all together for you because I want you to walk away from this video feeling confident and empowered, not worried or scared. A cat without teeth is not disabled. They're not broken. They're not doomed to a life of suffering or difficulty. They're simply a cat with a different set of physical circumstances. Circumstances that are incredibly easy to accommodate with the right knowledge and approach. The key is understanding that cats are already designed to eat without much chewing. The key is choosing the right food, primarily soft, wet options, with alternatives if your specific cat and situation allow for it. The key is paying attention to temperature, texture, and portion sizes. The key is patience during the recovery period. And the key is trusting that your cat's body is remarkably adaptable and resilient. Thousands upon thousands of cats live full, happy, completely normal lives without teeth. They play, they purr, they cuddle, they hunt toy mice. They knock things off counters, all the normal cat stuff. The only difference is at mealtime, and even that difference is minor once you've got the right routine established. And remember, removing painful, diseased teeth isn't taking something away from your cat. It's giving them their life back. So if you're watching this video because you're facing this decision, take a deep breath. Your cat is going to be fine. Better than fine, actually. With your love, attention, and the practical knowledge I've shared with you today, they're going to thrive. If you found this video helpful, please smash that like button. It really helps more people discover this information when they need it most. And definitely subscribe and hit that notification bell so you never miss our future content on cat health, behavior, and care. Drop a comment below and let me know your experience with toothless cats, or if you have any questions I didn't cover. Remember, knowledge is power, and you now have the power to give your cat an amazing life, teeth or no teeth. Thanks for watching, and I'll see you in the next video.